I always say weight loss is a side effect of hormone balance. So, you know, if you get that fixed, it makes it a whole lot easier. Hi, welcome this week to The Naked Doctor. I'm Dr. Tammy.
And I'm Dr. Debbie.
And we're the doctors. We have a great show for you today. It's gonna blow you away. We're gonna show you some crazy stuff that you've probably never heard of for wacky weight loss diets and things. It's creepy. Desperation. And some things that I never thought of, and I thought, at one point in my life, I probably would have thought that wouldn't sound too bad. So you're gonna wanna stay tight for the show today. And at the end, we're gonna tell you 3 things that you can start doing today that might change some of that narrative that you can actually have your power back. And so that's one of the things too, that when we counsel people is that we want them to take their power back. And of course, we always have to weave in the hormones. If your hormones aren't balanced, then it is true. And I have patients tell me all the time, my doctor fussed at me and even yelled. I've even had them berate people saying, go lose weight because you're sick or you're this or you're that. And then they come to me and they're already like scared little dogs and, and they're like, I don't know what to do. I don't eat that much. I've really tried. And I just tell them, you know what? If that's true, it's probably not your fault. It's your hormones. They feel ashamed. There's a lot of shame in not being able to fix something.
That's not productive.
And we have such a culture that we look at people who are overweight and we judge them as lazy or, it's easy to do that. So there are, real medical reasons, and not just medical reasons, because the medical profession will often say, you need, I always say a headache's not an aspirin deficiency. They'll throw weight loss drugs at them or something, and it's like, I call that dieting with interest. You lose the weight and it comes back with 5 pounds.
Yeah, super restrictive diets without other changes. No.
It's not sustainable at all. So I always say weight loss is a side effect of hormone balance. So, if you get that fixed, it makes it a whole lot easier. So we're going to talk about a lot of things. One of the things we're going to talk a little bit about is what's happened over the past year with the COVID lockdown, and they're calling it the COVID 30 because it's an average of 30 pounds that people have gained, and we'll talk a little bit about what's behind that. And you work in anesthesia, and so you see all the time the complications. So there's 2 sides. You can either lose weight because you want to look good in your little black pants, or you can lose weight because you don't want to die from complications.
Right, yeah, and just the physiological response to our bodies that are overweight impact healthy people, and so obviously also surgical patients. It's always best to be optimized in your health when you're having any type of surgical procedure. Or, as you mentioned with COVID, patients that are obese don't do as well. Our body doesn't deal with stress as well when it's overweight. And however, like you said, the components that go into being overweight often it's not just a matter of what you eat and what you expend. There's other things that come into play.
And that's what we call comorbid conditions.
That's right.
It has a whole other kind of bag of meaning too in that way. Okay, so hang tight. We'll be right back with the Naked Doctor.
Yes, I just got my first dose on Friday, and today is Tuesday. And after the accident, my brain was so hot. Inside my head was always hot, and that contributed a lot with the headaches. And after I got the stem cells on Friday, my head is so cool, and the inside is cool, and I just feel so enlightened and awake, just more alert all the time. And it's like they keep working for 3 months, and I'm just so excited to see, okay, in 3 months, if it's this different and amazing already, what's it going to be in 3 months?
Hi, welcome back to The Naked Doctor. I'm Dr. Tammy.
I'm Dr. Debbie.
We are having so much fun today. This is a crazy show. We're going to tell you some crazy things that people are going to lose weight or try to lose weight with. They say that a third of the population is obese, and it's really gotten bad the past year, and we just kind of mentioned that before break. And they say that on average, most people try, not maybe so focused and dedicated, but anywhere from 10 to 15 diets a year.
Oh my gosh.
So, it's constantly, people are constantly in their mind saying, I'm on a diet. Or they'll think, I'm going to cut out sugar, and they'll do it for 2 or 3 days. Or they'll be on to the next thing like keto, and they'll do that for a few days. So that's a tremendous market, and that's a tremendous marketing movement. And so that also includes supplements that people have tried to lose weight. And full transparency, I'm going to talk a little bit about my new supplement company here at the end. But yeah, so I personally have just, moved around so much through my life with hormone problems, not understanding them, but like the cabbage soup diet.
Yes.
Low carb, high protein, low fat. It's interesting too. I think one of the worst things that happened was the low fat movement. Because when people did low fat,
They did high carbs.
high carbs, and we saw the heart
Yeah.
problems go up. And
Inflammation.
Obesity. And I think one of the things that the messaging happens, and it was funny as I was doing, my research for weight loss was, I typed in weight loss and an ad for chocolate chip cookies came up. So it's like, what clearly have I been, because, social media tracks you clearly with advertising. And I'm like, so what have
I been looking for?
Yeah. And they're like, oh, you want to lose weight? Well, here you go.
Have a cookie.
So, but, and it's just over the years, and I've always kind of tried to try things that I would recommend or help my patients with. So I've pretty much done it all. If it's a weight loss drug, I've tried it. Phentermine makes you jittery, and just, nothing ever really did I feel comfortable with, recommending to patients, because I was like, But supplements over the years have been very valuable. And so what I find is that in hormone balance, and when people are balanced, weight loss is a side effect. So I always say you get healthy to lose weight, not lose weight to get
Exactly.
healthy. But yeah, so a little bit in anesthesia, I mean, you see that all the time. I mean, why is it so much work to, for an obese person to struggle then?
There are lots of reasons. Just the pure physical nature of it. Anytime that you're wanting someone to be ventilated, such as under anesthesia, it's more difficult the larger a patient is. Typically, along with weight come other, as you mentioned earlier, comorbidities, that being cardiovascular disease, insulin resistance, diabetes, all of these things, high blood pressure, all of these things that come into play that not only can perhaps make the technical aspect of surgery or anesthesia more difficult, but your healing. Your tissues aren't as healthy when your circulation is not as good, and all of these things, including even the stress hormones that can precipitate weight gain, that also comes into play. So back to hormones again, but yeah, there are implications in our daily lives, but then also, in the event we need a surgical procedure. So we do count it as a comorbidity within our preoperative evaluation, weight loss or weight management.
I'm just thinking all sorts of things that popped in my mind as you were saying that. You're having to watch their blood sugar throughout, make sure they don't crash. You're having to watch their blood pressure, make sure it doesn't get too high and they stroke out, or too low and they die. And it's just so much work. I'm sure on you, it's much more management. And then people go through thyroid storms sometimes during stress, and then you have to give them cortisol if they, I can't imagine how stressful.
Cascade of events. Yeah, the more optimized you are, the more healthy you are, then of course, better your outcome. And even just from a rehabilitation standpoint, you look at someone who's had a knee surgery or a knee replacement, and then we expect them to get up and walk. Well,
oh yeah,
and we expect, in the situation of a knee replacement, we expect them to not only walk, but for that knee to last them 20 years or more weight causes more wear and tear, also more difficult to rehabilitate yourself and mobility.
Absolutely. And then the wound healing. Of course.
Absolutely.
And you see all those, we call it dehiscence, where it pops
Yes.
open, and infection. And all the other risks as well. And your body, your immune system's not as strong. It's kind of interesting too. We were talking a little bit about COVID, the COVID 30. On average, people have gained 30 pounds during this, and a lot of that staying home. Gyms are closed.
Yes.
We're carb eating for stress.
And depression. People are locked in away from loved ones, and so they comfort themselves with food. It's been a cycle, and it's worse than the freshman 15.
Yeah, I had that.
Twice as bad.
And I remember, I can remember wearing big sweats and stuff and thinking, with the dryer was just shrinking my clothes. And I was comfortable because it's just easy to, wear yoga pants. We didn't call them yoga pants back then, I don't even think yoga was a thing.
I called them sweats.
Yeah, they were just sweats. Yeah. And I just remember, and I can remember, walking through stores and seeing those cute little leopard clothes and stuff like that, and thinking, I could do that. I could pull that off, but it was just so much more comfortable too. And you kind of go into denial. You start going into that place. Plus, I had lots of hormone imbalance issues. And one of the things that happens is when a female has what's called estrogen dominance, or too much estrogen, you gain a lot of weight in your hips, and those cute little things just don't look good on you. So you get frustrated, and then it's like, oh, well, I'm frustrated now and depressed, so let me just...
I'm going to eat.
And that definitely is a cycle.
Absolutely. Well, and with regard to our apparel, we've done that during COVID as well. People aren't getting dressed to go to work or to go out to eat dinner. And if we do, we wear our sweats or our leggings. So.
And we're behind a mask, so nobody knows who we are.
We can get our cookies under there, though.
Yeah. That's right. Something under there. So let's, this is kind of fun, and we'll just start a few, and then we'll come back after a break. But I do kind of want to mention, as far as supplements go, that you don't always know what you can trust out there. There have been a lot of people who've made a lot of claims, and as I was developing my supplement company, it was very important, just from authenticity and integrity, to not say anything or make claims, because everybody's different. And so that's just an authenticity, integrity standpoint. But there are actually some companies who know that they're going to make so much money from something that even if they get slapped with fines or lawsuits or anything like that, the money that they're going to make
come out ahead.
So much bigger. So here's some kind of crazy ones. So Dr. Oz, he's kind of one of the most famous ones for getting in trouble. One of the resources I was looking at said one of the last accumulative things was like $9 million for saying it's like magic fairy pixie dust. Yeah, because he was on there and he wouldn't disclose when he had financial gain in something. And so that can get you really in trouble pretty quickly. And some other people have had trouble too. There's a company called Sensa out for a while where you sprinkle this stuff on your food so it would taste good, I guess. And they made some pretty outlandish claims, 26.5 million. So if they were willing to take that risk to the tune of 26.5 million, you can only imagining the marketing narrative that they were telling to get people to sprinkle this stuff on their food. And then there was sauna hot pants. Tinfoil pants, right? So instead of the tinfoil hat wears tinfoil pants. Oh, and then there was caffeine pants, and they got in trouble to the tune of about $1.5 million, basically, for saying that it was going to cure your cellulite. Well, it was, curing your obesity issues. So it might be like squeezing you in. Lobster cream. So I guess they said that there was something that they got from the crustacean part of the lobster or something that would instantly make you, lose weight without diet or exercise. And I think that's the biggest claim that people make is without diet or exercise.
No shortcuts.
There's no way. There's no shortcuts.
No shortcuts.
If you're looking for a shortcut or a magic pill, they're just not there. And that's, if someone tells you that, then...
Well, if you are, then we'll find some foil pants.
Yeah, then we'll find some foil pants. That's right. So, so lots of great stuff. And, some of the other things that you have to be leery of is the really outlandish stuff, and not go to extremes either. Because like you said, you know, whether it's an obese person or a person that's losing and gaining weight, puts a lot of stress on the body.
On your body.
And the heart. So one of the things they listed was wiring your jaw shut. Have you ever heard of that? That's crazy.
Only with a fracture, but no.
Right? Yeah. I mean, it's really extreme. So, you know, and it just kind of speaks to the extreme that some people would go to because they feel like
Their desperation.
Their desperation, absolutely.
Well, they may have tried common sense things before and it didn't work because the whole person wasn't looked at. You know, one person could reduce calories and exercise and have one result while another would not. It goes back to hormones.
Genetics have a huge piece in that
Absolutely.
too. And so you look at families that are all very obese, there's something going on from insulin resistance to things in their DNA that, and I love to do genetic testing because it's just so nerdy and cool. And I can just deep dive into all that stuff. But, you know, nurture versus nature. Yes. So, you know, nature is your DNA and then the nurture, I think it's fascinating because I've read things on PCBs that are in plastic. So when you heat your plastic and you eat or drink out of that, they say that those obesogens, which what they call them, can go down to 2 or 3 different generations in the DNA. So the things that you're doing, you sit in a water bottle out in the hot car.
And drink it.
Oh yeah, or put plastic in the microwave. And it's cumulative. I mean, do I drink out of a water bottle? Absolutely, I do. I'm very conscientious about putting plastic in the microwave now, but yeah, so lots of ways that you can look, and you know, it doesn't mean that you have to do everything, but for the sustainable, really being mindful.
Yeah, a lot of components.
Okay, so here's the creepy extremes.
Great.
A tongue patch. That's crazy. So what they do is they take a little piece of mesh, kind of like, I guess like what in surgery when they do like...
like a hernia repair or something of that nature.
Yeah, a little piece of mesh. It looks like a gauze pad. And they sew it to your tongue so that you can't eat.
I could probably find a way around a patch.
Yeah, I think I could find a way around a patch. That's just super extreme. A tummy tube. Like literally, they put a tube in your stomach so that when things go in, it literally comes right out. Yeah.
I don't want to go to dinner with that guy.
I know. I guess it's got a little plug. You just unplug it and then just go. You know, but that leads to, you know, binging. And we know that bulimics who binge, I don't know if it's so much, maybe you've heard different, the psychiatric components to having control over your body versus, I think with obesity, a lot of people feel out of control. And so they can go to the extreme. Now they find something like vomiting or, you know, purging.
Exactly.
And they have that control over it. And
well, and the impact of that on the rest of your body without absorption of the nutrients, because you're bypassing the part of your intestine where you're going to absorb those nutrients. So now they may be thinner, but they're going to be unhealthy and suffer those consequences.
Well, and think about bariatric surgery, and I've seen people get great results from it. I've also seen people gain the weight back, and that's so extreme. And I don't think that, I mean, we have some great docs locally, but I think that there are nationwide some doctors who, I've had patients come to me who haven't talked about like B12 injections and things like that because they just can't absorb it through what little stomach they have left. And so they don't feel good, and you need B12 in your DNA and your metabolism. And
just the psychological component of it. Like you said, you can gain weight back, and you can. And also, I've known people with gastric bypass surgery to feel as if they've cheated. It's still not a cheat. You still have to do the work. If anything, perhaps even more so, because you've now got to sort of assimilate to this life that's very different, very suddenly. So, yeah,
that's fascinating. I never thought about that before, because internally, I'll just be real. When I hear somebody who says they've had gastric bypass, I think that's like cheating too.
I think that's common for people to think that, and I feel empathetic toward these patients because, one, they've undergone a big surgical procedure and rehabilitation, and then, like I said, they still have to do such dramatic lifestyle changes. So you kind of
compound
cheating.
They still
in
the pain and suffering and
absolutely
vomiting and
It's a lot.
Recovery. Yeah, that's good. So, people, I have noticed that people are very quiet when they talk about having gastric bypass. They don't offer it often. Of course, when they come and talk to us, they have to tell us.
Yes.
We need to know,
We need
right?
to know.
But it's not real common to tell us. Okay, we're going to take a little break, and we're going to come back and talk about some other extreme diets. Hi, welcome back to The Naked Doctor. I'm Dr. Tammy.
And I'm Dr. Debbie.
We have a great show, and we're talking about weight loss and some of the extreme things that people do. But again, it's out of desperation usually, and people are often told, well, just eat less and exercise more. And then frustration breeds more frustration, breeds going back to maybe unhealthy habits. And then they're kind of stuck. And so we were talking a little bit on break about thyroid, and I can pretty much guarantee you that if you have a weight problem, you have what we call the subclinical low thyroid.
Hypothyroidism. Yeah.
And so your story was kind of that you try to get people to listen to you. And
Yes, and my presentation, like a lot of people's, was atypical. I wasn't overweight and had some other symptoms that were consistent with hypothyroidism. Had looked at a lot of other things and finally found someone who would draw an entire thyroid panel because as we were talking, lab values, normals, are set by all extremes. And so what comes out in the middle, what might be normal for one person may not be for your own body, your own physiology. So, yeah.
you got to get the whole panel.
Yes.
You got to find somebody who will do all that. I like to do all hormone levels related to metabolism, at least that we're aware of. You know, that's the more common. So not just the whole thyroid panel, not just a TSH,
Right.
but the whole thyroid panel, but also your insulin levels and cortisol levels and your male and female hormone levels, and just so important. I mean, I just can't express that enough. And then it's so crazy because I always say women are like a light switch, or men are like a light switch, and women are like the cockpit of an airplane. When our hormones are more complex, and so you really want to find someone who understands that complexity too. Because if you've ever tried to diet alongside a man, it's usually testosterone driven. It's pretty plain and cut and dried. You've got low testosterone, you're going to start getting the belly
fat.
And then with women, we, because we carry babies and stuff, we have all sorts of different female hormones, thyroid hormones. I mean, it's like, and usually it's funny because when I test a male for all his hormones and the testosterone's low, once we treat that, they fall into a line so easy because I don't even want to treat a thyroid. If I see a guy with low T and we put him on testosterone, but the thyroid's out of whack, I'll be like, let's wait.
It'll come
Let's
up
treat
behind.
that.
Yeah.
I see that with women some too, but boy, if someone's tired and gaining weight, not feeling good, and brain fog, dry skin, hair falling out, you got to address that pretty early on and not wait for the rest of it to kind of settle
Fall
out.
apart. Well, and you mentioned brain fog, and with regard to checking an entire thyroid panel, it's important to treat the entire thyroid as well because we have a portion that impacts our mentality and our mood, and then the master one that sort of impacts all of our other hormones. So we look at T3 and T4, and a lot of physicians in the past, I think maybe it's better now, but didn't look at that whole component, only treat it with one side of the thyroid. So people might get some improvement in, say, their cholesterol or their weight, but then they still had some of the depression and anxiety, things that go along with the other component to thyroid.
Yeah, it's so funny because a lot of people come in on just levothyroxine or Synthroid, which is just T4.
Yes.
And they might need T3.
Yeah.
And so the first thing I'll do is switch them over to combination product, and usually they feel a lot better. And then some dietary changes. I like the food sensitivities because sometimes grains, gluten and things like that can cause some autoimmune type things that start chewing up the thyroid. So, you fix that and they feel better then too. But yeah, absolutely. That's a great point. So if you're just on a thyroid medication that is just T4,
Right.
then the doctors are, missing that loop. Yeah, so thyroid is fascinating. And if you don't get that combination product, a lot of times, it's funny, I was at a barbecue one time and there was a bunch of people there, and there was this lady, extremely obese, and we're talking, and, as soon as they find out your doctor, they start
Spilling.
going into spilling. And she's like, yeah, I got on thyroid medicine, and she's like, I'm doing great. And I'm like, oh, really? All right, so a couple other extreme things.
Yes.
Tapeworm diet. Can you imagine giving yourself tapeworms? I've joked about that though before. I'm like, I wish I had a tapeworm.
Well, when you're little and you're thin, you must have a tapeworm.
Yeah.
So someone's like,
Yeah, I'll do that. And ear staples, that's kind of a thing too. And I guess they do that with smoking and some other things too. I guess there's some acupuncture thought to that. It could have some.
That could have some validity.
If I had a freaking staple digging in my ear though, I might be like, I don't want to eat right now.
You'd be distracted.
Yeah. So lots of other crazy things, but I think another thing that you might want to consider is doing an assessment of behaviors, because it is about behaviors too, and it is about, which I do think the behavior comes from potentially the stress and the hormone imbalance and things like that, but just being awareness is really important.
Yeah,
When do I eat?
mindfulness.
When do I eat? What am I eating? Why am I eating that? Just ask yourself those questions.
Right. And I think just not going to extremes. I think if you attempt something you can't sustain, then you are a setup for failing. Then you feel like a failure, and then that feeds into the whole dynamic of why perhaps you're overeating or too self-conscious to go exercise. All those things. Be kind to yourself. And don't set yourself up for things that aren't sustainable, so that you can, succeed and enjoy those little steps. It'll feed on itself.
And when you have cortisol imbalances or hormone imbalances, you do crave sugar.
Yes.
And so I always say your hormones talk louder than your willpower.
True.
So, if something's going on there, you want to address that as well. And but I think we do make excuses too when we don't have at least those little wins, and we're like, well, I deserve this cookie and we're cultured and conditioned from childhood, skin your knee, get a cookie.
Get a cookie. Yeah.
A reward. My son came home from school one day and he had a little bag of candy, and I'm like, what is that? I mean, he has candy sometimes.
Yeah.
I'm not like that mom, but I'm like, oh, and he said, well, he got some, good grade or something, and so the teacher promised him at the end of the week they get that bag of candy, and I thought, what are we doing? We're rewarding with sugar.
Well, my kids, when they were in elementary school, were rewarded for reading a book and doing a report with a soda.
Oh, great. Yeah, that's
And
wonderful.
soda was something they didn't have at the house.
Yeah.
So, of course, they thought that was just great.
Yeah. Yeah, what are we doing? It's just crazy. So I promised 3 ways that you could start today making some changes. And one, again, is just take inventory. Why are you eating that? When are you eating that? And do a little research. So if you're hungry in the evenings, maybe you're having some sort of cortisol spike, go to a doctor who will actually listen to you, and you can say, hey, I think it's this, or hey, I think it's my thyroid. If they won't listen, then find someone who will, because there's something going on. If you're really giving it good effort and you're not making excuses for what you are or aren't doing, something's going on.
Right.
The other thing is meal prep, because again, it's going to come down to you get hungry. When I go
You
grocery
grab.
shopping hungry, you know that goes.
It's a problem.
Yeah, it's a problem. So you have to plan ahead for sure. And then mindful eating, and just slow down and think about it. And what am I eating when I'm eating? Just that mindfulness, and make sure you're chewing slow and doing those.
And
kinds of things.
make an addition to that, be sure you're hydrated, because dehydration mimics itself as hunger.
It absolutely
And
does.
drinking, of course, not soda, but water, things that are, some green tea even, but just water, definitely. Sometimes our body's hungry, thirsty, and it tells you it's hungry.
And a hydrated adipose cell functions much better to utilize fat as energy if it's well
That's a great
hydrated.
point.
Yeah, I think people underhydrate too, because they say half your body weight in ounces. So like for a 150-pound person, 75 ounces a day of water is, if you're going by the 8-ounce glasses at 64 ounces, you're falling short.
I actually took a picture off of one of your previous shows of that very diagram.
Yeah.
It was enlightening. I needed more water than I thought I did,
It's easy to miss that.
Yeah.
So over the years, here's my little shameless plug that I wanted to talk about just a little bit. Over the years, people have come to me and asked me, will you give me a quick fix? Will you help me with the little wins? And I was always resistant, because I say you lose weight you get healthy to lose weight, not lose weight to get healthy. But people do want those wins, and so I do like those easy wins, and to help them and build that, just
Motivation.
Motivation. And so I had a friend year before last who came to me, and she said, please, 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 will you do something? So over the past 20 years of working with patients and hormones, and I've used supplements, right? So I test them for their deficiencies, give them supplements, and they would do well. So not just the hormones, but they would do well with the supplement. So over the years, it's been white kidney bean extract. I absolutely love that, because it blocks the enzyme in the stomach that breaks carbs down into simple sugars. So you can eat more carbs. And I'm not saying, I'm not making that claim that I get in trouble for, that you don't have to change your behavior, but you can get away with a little bit more.
Yeah.
And it sort of puts you into a little bit more ketosis. So if you like the ketone idea, you can do it without killing yourself, which is kind of nice.
It's a bonus.
And then I pretty much took everything, I call everything but the kitchen sink, and put everything that I normally for metabolism supplements into it to help people. So my little shameless plug is carb melt that I formulated, and it's also got chromium and magnesium and B12 and all the things to help your DNA work better, and we've had really good results with that. So and then LipoMelt is everybody's like, well, if that works so well for insulin and blood sugar issues, then why do I need this? And we're actually changing the name of this to Belly Melt, so that it makes more sense.
Specific.
It's more specific, right? And in marketing, you always have to be more specific.
Right.
So if you have adrenal fatigue, and we didn't even talk about adrenal hormones.
That's a big topic.
This has a form of licorice that actually helps with adrenal fatigue. So when people are tired, then you don't sleep well. And it's got a ton of other things in there too. But yeah, definitely if you feel like your adrenals and you have a cortisol belly melt or LipoMelt, which until that runs out, we're going to switch it over. And then we have a protein powder too. So for the carb cravings, that's really good. It has like a vanilla flavor. It's nice, but
Tastes good.
yeah. And a lot of times, if I'm in the evening, if I want to just eat some junk, it's so sweet and it tastes good.
Yes.
That I'll just do that instead.
It's a treat.
And then I'm full, and then it's a little treat too. I would say be careful when you buy your protein powders, because I had a friend with a keto protein powder and sent me the label and said, hey, how does this look to you? And it was actually 2 grams of protein and 22 grams of sugar.
Oh my gosh.
And it's supposed to be high protein, low sugar. And it was exactly the opposite of what ours is and what it's supposed to be. And then I also threw some other things that help, chromium, magnesium stuff for weight loss too, and some anti-inflammatory agents. So it's a good little combination together. It's not everything you need. It's not all your irons and nutrients and things that you need, but it's been really, really successful. So if you want some little wins, definitely in addition, or if you're not quite where you want to make that leap to be vulnerable and go through your list of doctors to try to get them to listen to you, it's definitely something that you can try. I recommend. And easily accessible, carbmelt.com. There's a little shameless plug. But anyway, so we just want you to be super healthy. Just focus on being kind to yourself. I love that, because at the end of the day, it really is just stay the course. You'll find your path. But don't beat yourself up, because that's the worst thing that you can do. So we could leave you with
It'll
anything.
sabotage you.
Yeah, self-sabotage
Yeah.
is huge. So you can find us on The Naked Doctor on Facebook. You can find us on pretty much all the social media, Instagram, Twitter, and then we have thenakeddoctorshow.com. Please leave us comments. The YouTube channel is Dr. Tammy Tucker, so you can go there and you can watch all of our shows on the YouTube channel as well. And we'd love for you to leave comments and like us and subscribe and let us know that you're out there and that what kind of content you like, what's meaningful to you. All right, so until next week, we love you very much and have a blessed, wonderful week, and just be kind to yourself. We love you. Bye.
Bye.